Hello everyone, my name is Ma Diyuan. I'm honored and proud to have the opportunity to speak at this meeting to share with you our study. Is acupuncture an effective approach to manage neurogenic detrusor and underactivity? A single-center prospective study. This is my disclose, and I'm funded by myself. According to the definition of ICS, detrusor underactivity refers to a contraction of inadequate strength and or duration resulting in prolonged emptying and/or failure to achieve complete emptying in the absence of urethral obstruction. Basically, DU can be classified into idiopathic, neurogenic, myogenic, and mixed types based on the different etiology. Despite a number of innovative therapies emerged, management of neurogenic still remains a challenge, so our study aims to assess the effect of acupuncture on neurogenic DU. Inclusion criteria of the study was a patient more than 18 years old with a history of neuropathy, with chronic urinary retention required a catheterization, including clean intermittent catheterization and indwelling catheter, with DU diagnosed based on the urodynamic criteria of bladder contractility index less than 100 for men, and a maximal flow rate which is Qmax less than or equal to 12 ml per second combined with a detrusor pressure at Qmax less than or equal to 10 cm water for women respectively. The exclusion criteria included the patient with bladder outlet obstruction and previous invasive procedure, such as sacral neuromodulation and pudendal nerve stimulation, with mental or coagulation disorder. In terms of the acupuncture procedure, we selected the acupoint, including bilateral BL33, BL35, SP6, and SP36. The needles were sterile, disposable, stainless, and 100 mm long and 0.4 mm in diameter. After the needles were inserted into those acupoints, a portable electroacupuncture machine was connected to the handles of needles located in BL33 and BL35 to provide the electro stimulation for 30 minutes with a frequency of 10 Hz continuous wave stimulation, 3 times a week for 8 weeks. The primary outcome was the response rate, which was defined as the proportion of patients with a voiding efficiency of more than 50%. The secondary outcome included post-void residual urine volume, Qmax, detrusor pressure at Qmax. Additionally, the adverse events were also recorded. A total of 37 patients were received acupuncture intervention. Of those, 12 were male and 25 were female. 6 patients had hydronephrosis. After 8 weeks, 4 male and 21 female patients could void spontaneously, and 18 of them achieved a VE of more than 50%. As a result, the response rates were 48.6%. Furthermore, the change in PVR, Qmax, and detrusor pressure at Qmax were also significantly. The hydronephrosis was disappeared in 1 patient and improved in 3 patients after 8-week treatment. Additionally, subcutaneous hematomas were found in 3 patients and no severe adverse events were reported. The main finding of covered study is that almost half of patients showed good response to acupuncture, and the urodynamic parameters were improved significantly after the treatment. The potential therapeutic mechanism of acupuncture might be the stimulation on S3 via BL33 and the pudendal nerve via BL35 and SP6. The important limitation of our study is lack of control, which will be solved in our future study. Our study suggests that acupuncture might be an effective procedure to recover spontaneous voiding, as well as improve PVR, Qmax, and detrusor pressure at Qmax in patients with neurogenic DU. Thank you for watching.